Hi, I'm Dr. Al Turry. I'm a board-certified doctor of audiology with 5 offices throughout Greater Orlando and Claremont. The reason for this video is 1, to introduce myself, and 2, to have a short conversation with primary care physicians and physicians in general about the role of audiology. Here's what happens typically. A patient goes to see their internist or their primary care physician or their family doctor complaining of ringing in the ears or hearing loss. The wife is concerned that the husband's ignoring her. Many things like that, typically. Occasionally, a very small amount of the time, it's because of pain in the ear, a perforated tympanic membrane, a fissure of some kind in the ear canal. ENT's needs, as far as the typical patient at the primary care level, is roughly 7-8%, where the problem, the symptom that the patient came in worried about is a surgical condition or a medical condition. 92-93% of the time, it's presbycusis, recent onset bilateral tinnitus that's benign, so not a tumor or a lesion. Only, like I said, 7 or 8% is it perhaps a perforated eardrum, a stapes disconnection, an ossicular chain discontinuation, or some type of predicament or symptom or pathology that requires a surgeon. So that means when we send a patient to ENT, typically it's not really needed. So 3 things happen. First thing that happens is the patient has to wait weeks typically for an appointment. Secondly, in addition to a very simple hearing test that the audiologist would do quickly and probably next day, maybe same day, depending on if you call us in the morning or the afternoon, the patient, in addition to that test, also has to sit through a very lengthy and costly consult with the ENT. So it's expensive, it takes a long time, and thirdly, a lot of primary care physicians tell me that when they send a patient to a specialist, they have concerns that they lose that patient for whatever reason. So when you send patients to Harmony Hearing, to Dr. Turry, the audiologist, and our team, 3 things happen. 1, we get your patients in quickly. Secondly, we assess their needs. And if there's something surgical, if there's something medical that requires the specialty of otolaryngology, we've got great relationships with ENT. We work with you to see who your preferences are, and we get the patients where they need to go if there's a medical condition that requires otolaryngology. For that 92-93% of the patient that simply has benign tinnitus or presbycusis or noise-induced hearing loss, we get you a detailed report so that you know what's going on. We counsel the patient accordingly, and if they're ready for help, we help them hear better. If you look through the rest of our website here, you'll find our philosophy on hearing loss and hearing loss treatment to be that of family. Our patients are counseled, they're educated, they make decisions for themselves after they're educated, and if they want help, we're there to help them. If they're not ready for help, we make sure that they get some information and they come back and see us when they're ready. And the third thing that absolutely happens if you send your patients to us as opposed to otolaryngology is you get your patients back. We're going to direct the patient to come back and see you because we tell them that we're going to send you a detailed report of our findings and our recommendations, and we encourage them to make a follow-up appointment with you, their primary care physician, so that you can counsel the patient as well from your concerns regarding their overall health picture and how the results of their audiology testing impact your life. So thank you so much for taking the time. We look forward to answering any questions that you have. FixMyHearing.com is a great resource for you to learn more about us. My direct email is drturry@FixMyHearing.com. That's DRTURRI@FixMyHearing.com. So feel free to email me directly if you have any questions. Thank you so much for watching. I appreciate it.